A 34-year-old woman comes to the physician complaining of fever, dysuria, and flank pain. Her temperature is 37.8 degrees Celsius, blood pressure is 122 by 78 millimeter mercury, and pulse is 84 per minute. Physical examination elicits suprapubic and costovertebral angle tenderness. Urine dipstick analysis reveals positive leukocyte esterase and nitrite. A subsequent urine culture grows colonies of motile gram-negative rods demonstrating a green metallic sheen on eosin methylene blue, or EMB, agar, and hemolysis on blood agar. The question is, which of the following is the most important bacterial factor responsible for this patient's condition? Your options are choice A, capsule, choice B, heat label enterotoxin, choice C, O antigen, choice D, Fimbrial Antigen, choice E, lipid A. Type your answer in the comment box. Congratulations if your answer is D, which is Fimbrial Antigen. Escherichia coli is part of the normal bacterial flora of the intestinal tract. It is a motile gram-negative bacillus that is facultatively anaerobic and able to ferment both lactose and glucose. E. coli grows well on blood, McConkey, and eosin methylene blue, or EMB, agar plates. EMB agar is a selective and differential medium used to isolate and identify enteric pathogens from contaminated clinical specimens. On EMB agar, organisms that ferment lactose, such as E. coli, bind to die in the agar and produce colonies that have a distinct green metallic sheen. Most strains of E. coli also demonstrate beta hemolysis on blood agar. E. coli is responsible for urinary tract infections, neonatal meningitis, and several types of gastroenteritis. The virulence factors expressed by a particular strain of E. coli will determine disease characteristics. Fimbriae or pili, type 1 Fimbriae, P. Fimbriae, and S. Fimbriae are one of the most important virulence factors expressed by E. coli. They permit the adhesion of E. coli to epithelial cells, uroepithelial cells, and enterocytes. E. coli causes approximately 80% of all UTI. UTIs are more common in women than men due to the female urethra being significantly shorter. E. coli originates in the feces and spreads to colonize the perineal, genital, and most importantly, the periurethral regions. During sexual intercourse or bladder catheterization, E. coli can be propelled into the urethra and bladder from the colonized periurethral region. P. Fimbriae, pyelonephritis-associated pili, adhesion then allows uropathogenic E. coli to colonize the bladder and ureters, causing cystitis and pyelonephritis. If you chose any option other than D, you were incorrect. Let's briefly discuss the other options. Choice A is incorrect because E. coli strains causing neonatal meningitis synthesize K1 capsular antigens. The K1 antigen is considered the major determinant of virulence among strains of E. coli that cause meningitis. Choice B is wrong because enterotoxigenic E. coli produce heat-stable and/or heat-label enterotoxins. Heat-stable activates guanylate cyclase, causing an increase in cGMP. Heat-label activates adenylate cyclase, increasing cyclic AMP levels. In both structure and mode of action, heat-label is very similar to the cholera toxin. Choice C cannot be an answer because the O antigen is a variable polysaccharide antigen found on the outer membrane that is used to classify gram-negative bacteria. It is the most extracellular component of lipopolysaccharide. Choice E is incorrect answer because the lipid A component of lipopolysaccharide is similar for all enterobacteria. Lipid A causes activation of macrophages, leading to widespread release of interleukin-1, interleukin-6, and TNF-alpha, which in turn causes the signs and symptoms of septic shock. If you're finding this difficult to understand, consider watching this episode again.